who is the Technical Advisor, Maternal and Child Health. We also have Ms. Lizette Bell, who is the Deputy Director of Health Services in Nursing. And we also have Dr. Javier Zuniga, who is the Director of Policy, Planning, and Project Management Unit. So these are three experts this evening who will be helping us to decipher the information and also go through questions that you, the audience, will be providing us with. So we would just like to start as well with explaining to everyone the purpose of this report. And it is to provide the public with updated information about the country's COVID-19 situation. Of course, this will be divided into 4 segments. And the first segment would be data, more on the COVID-19 testing and the status of that. The second segment would include hospitalization, which would also include the ICU admissions, hospitalized cases, and mortality rates. The third segment would be vaccines, and this would allow us to know how we are doing as a country with the vaccinations. The last segment would be the question and answer from the audience and media houses. So we do invite you to drop your questions in the Facebook Live comments and let us know what is on your mind when it comes to questions and concerns that you have on the current COVID-19 situation so that we can pass it on to our panel of experts and they would be able to help us decipher all that information. So we would like to head straight into it, and that is, of course, to start with the presentation of the data. I would like to invite Nurse Bell, who will be explaining the testing data to us.
A pleasant good afternoon. I will be presenting an update of the data as it relates to testing for Thursday, October 7th. The total number of testing that was done for today is 1,847 cases. Of those, 294 were positive, and we have a positivity rate of 16.2. We have 896 persons under investigation, and 239 persons have recovered of the COVID. Of the total active cases, we have 2,549. Of those, 1,360 are females and 1,189 are males. For today's positive cases, we have 151 males and 143 females. The 294 cases are from mainly Belize District, with Belize City accounting for 69 cases, Cayo District for 62 cases, and the Stann Creek District 39 cases, Corozal District 24 cases, the Orange Walk District 27, and the Toledo District is accounting for 30 of those positive cases. Thank you very much.
Thank you for that, Nurse Bell. And of course, that is basically the breakdown of today's COVID-19 testing data. Now, I would like to invite Dr. Javier Zuniga, who will be explaining to us more about hospitalizations and mortality information and the data in context of vaccinations. So, Dr. Javier?
We have a total of 69 hospitalizations. 53 are at the COVID wards at the regional hospital and also at KHMH. And we have 16 that are ICU admissions. Of the total 69, there are 75 persons who are unvaccinated. 12% have received their first dose, and 13% are fully vaccinated. So I want to go a little further. In terms of the ICU unit, 75% of those individuals are unvaccinated. And in the case of hospitalization at the COVID wards at the regional hospitals and KHMH, there are also 75% of patients who are unvaccinated. All right? Now, I want to also go into further details, and there was one death recorded from yesterday to today, but I want to share some data for the past 2 months. And I want to go back to September 1st to October 6th, and I will share some relevant data in regards to COVID-19 deaths. So between this time, we have had, and this is little over a month, we have had 65 deaths recorded in Belize due to COVID-19. Of those 65, 25 have occurred in the 65 plus age group. This is followed by the 55 to 59 age group, where we have recorded 10, and also the 40-44 age group, where we have recorded 8 deaths. On a whole, what we see is that as the patient ages, so does the increase in death. All right, so there's an association there between age and COVID deaths. The second graph that I want to show you, which is for the same period of September 1st to October 6th, are COVID-19 deaths by age group and sex. So, of those then deaths that we have recorded, you'll see that the blue bar represents females and the orange bar represents males. You see that there has been more male deaths than female deaths. So, a total of 36 male deaths and 29 female deaths. If we look at the data as well, you'll see that more elder males above 65 years are the ones that are dying, okay? At the age group around 55 to 59, we see more females dying. But on a whole, as you see, it is both females and males that are dying. In the next graph, I want to also share with you the same period, September 1st to October 6th, COVID-19 deaths by district and sex. So, from the districts then, we will see that Belize district is the district that has recorded the most deaths, 31 deaths between this time period. Orange Walk district is the second district with the most deaths at 14. And then we have Corozal with 8, Cayo district with 7, Stan Creek with 3, and lastly, Toledo with 2. Again, male and females dying. One more chart I want to share, which is very important. I want to show you a table that has comorbidities associated with the COVID-19 deaths for these same deaths. And there are 4 conditions that basically appear as comorbidities within these patients. This includes diabetes, hypertension, chronic renal failure, and obesity. So you can see then, as the patient ages, the patient also has these, what we refer to as non-communicable diseases. And so these comorbidities are associated with increased age, and it's also associated with increase of deaths as well. So for example, we can see that for diabetes, we have patients basically in all age groups from 30 years old all the way to 65 plus that suffer from diabetes and have died. For hypertension as well, the elderly who suffer from diabetes are also, from hypertension are also the ones that are dying. And patients who have chronic renal failure, the same. Now, very important, and we want to also analyze data and go back to all the deaths that have been recorded with COVID. And we have also noticed that obesity is a major non-communicable disease that is also associated with COVID-19 deaths. But in another segment, we will bring that data to you so that you can see exactly what is happening with the deaths. Thank you.
Thank you so much for that, Dr. Nigat. We totally appreciate your breakdown of the hospitalization and of the mortality information. So now I would like to invite Dr. Natalia Beer to start with her presentation of data and the status of the COVID-19 vaccination campaign. Dr. Natalia?
Thank you. On the 4th of March 2021, we launched the COVID-19 vaccination campaign in Belize. Since then, we have had access to vaccines via donation and purchases done by the government. I would like to share with you all that globally, 6.4 billion doses of COVID-19 vaccines have been administered. 2.4% of this total amount of vaccines correspond to vaccines administered in low-income countries, where Belize fall into. Up to the 6th of October, in Belize, we have 144,531 persons who have completed their vaccination schedule, and this represents 33.5% of the total population. What is the target population that we are trying to cover with COVID-19 vaccine? Just like any other country, Belize is seeking to achieve community immunity, meaning we would need at least 71% of the total population to be vaccinated against COVID-19. Where are we? Up to the 6th of October, we have 33.6% of the total population receiving complete COVID-19 vaccination schedule. We have a gap then of 37.4%. If we look at the vaccination among children 12 to 17 years, the target population is 58,292, and this includes in and out of school children. So far, up to October 6, we have 15,142 children 12 to 17 years who have received or completed their second dose with COVID-19 vaccine. What that represents 25.9% of the target population. So we have a lot of work ahead of us. Remember, our vaccination campaign was launched in phases, and as we were receiving vaccines, the different critical frontline workers have been completing their second dose. And I'm happy to share that who is heading the coverage for the second dose is persons 60 years and older. By district, the data is segregated. We have Orange one up to yesterday, October 6th. They have the highest second dose vaccination coverage with 41.7%, followed by the Corozal with 38.7%, and then Belize with 36.6%. How do we compare with Caribbean countries? With the Caribbean countries, with our brothers and sisters from the Caribbean, we are not among the lowest, we are not among the highest. We are in the second tier of countries when we compare ourselves with the other Caribbean countries. So we have a lot of work ahead of us to meet the target for the country, which is a minimum of 71% of the total population receiving full COVID-19 vaccine, meaning second dose, or for the vaccines that only require one dose. Thank you.
Thank you so much for that, Dr. Beer. So now we would just like to remind the public that you can go ahead and submit your questions to us so that we can go ahead and ask the panel of experts here. And remember that the questions can range from any and everything when it comes to our COVID-19 situation. We do want the public to get the best, most comprehensive understanding of all that is involved in the COVID-19 situation. eventually. So the first question that I have here that I would like to invite the is, if you do not have a social security card, can you still get your vaccine? Great.
That is a definite yes. There is no restriction if you don't have a social security card. We're trying to protect the population. We encourage persons to carry their personal ID, to document in the BHIS that they are receiving the vaccine. But if you don't have it at that moment, you will get the vaccine.
Great. So Dr. Bear allowed us to know that whether or not you have your social security card with you, you will be able to get the vaccine. So just show up and get vaxxed. Another question that we do have is, do you know which variant is prominent at this very time?
I can answer. Yes, at this time we do highly suspect that the Delta variant is the variant that is causing havoc in the country, and that has led to the community spread and the increase of cases of COVID-19.
Thank you so much for that, Dr. Zuniga. So as he allowed us to know, the Delta variant is what is basically prominent at this very time in Belize. Directly related to that question now, we have another question from our Facebook Live. Remember, while we're asking questions, you can even ask more questions on the Facebook Live, because we would like, again, for you to get the best understanding of this entire situation. So another question is, why are more people dying since vaccines are available?
Okay, so at this time, as we said before, we have community spread, which means that there will be an increase in the number of cases. That increase in number of cases, of course, due to this community spread, will lead to an increase in the number of hospitalizations. And one of the high-risk groups for COVID deaths is the group with non-communicable diseases. We must understand that our population, we have almost 15% of our population that suffers from diabetes, another 12% that suffers from hypertension. Almost 80% of our population is either overweight or obese. Okay? And these are the leading risk factors that we have seen associated with the COVID-19 deaths. All right?
Thank you so much for that, Dr. Zuniga. So basically, that answers the other question that we had, which said, what can you say is a commonality in why people are dying? So thank you so much for that. As he allowed us to know, Dr. Zuniga allowed us to know, there are different causes when it comes to people dying from COVID. And those causes may be related to underlying issues, varying from hypertension to obesity to diabetes to much more. So we have another question here for the panel. And this question is, can you briefly explain the SI's main measure?
The SI main measures that we have put in place is the curfew measures, also to reduce the risk of exposures to COVID in high-risk areas as it relates to restaurants, saloons, and also contact sports. We have also discouraged such. In addition to that, the closure of the casinos as well, as those are high-risk areas. As it relates to the food establishment and vendors, the SI is indicating that persons who are vaccinated can access these restaurants if they are vaccinated and can dine in. However, those restaurants can only allow 50% capacity, and if they have a well-ventilated area, because as you know, with COVID-19, ventilation is very critical as it relates to the reduction in spreading of the virus.
Thank you so much for that, Nurse Bell. And just so that we can reiterate the new SI measures, we would just like to go ahead and announce that again. And until further notice, restaurants, saloons, diners, and other similar establishments are allowed to operate or may offer dining-in services by reservation only for no more than 50% of its seating capacity with fully vaccinated persons only. So this basically means that only fully vaccinated persons can actually make a reservation, right? Great. Thank you so much for clarifying that. Another point on the SI would be that restaurants that have proper ventilation, or a restaurant that is in an open-air restaurant, outdoor restaurant, or an al fresco dining restaurant that is allowed to operate may offer dining-in services by reservation only, again, for no more than 75% of its seating capacity with fully vaccinated persons only. So the percentage just varies depending on the type of restaurant you would be going to. Is that right?
Yeah.
Great. Thank you so much. The third regulation would be that churches and casinos are to remain closed. The fourth regulation is that contact sports are not allowed. So those are the four main points of the updated SI. Now we would like to move on to another question. And this other question says, does this information also include migrants without papers? So I assume that this information is in regards to the vaccination status. So does this information also include migrants without papers?
Yes, it does.
Great.
Once they live here in Belize, yes.
Great. So once they have gotten their vaccines in Belize, they are counted in our vaccination report, right?
Yes.
Perfect.
And in addition to that, for persons accessing the services as it relates to testing, we want to make it clear that your immigration status should not deter you from accessing the testing sites. So if you have symptoms or you're a close contact to someone who had symptoms or confirmed COVID, we advise you to go to the testing site to get tested.
Or any medical service.
Or any medical service for that matter.
Perfect. So once you are presenting symptoms, go
Just
ahead.
to add one more thing, because we were speaking about social security card, and as Doc said, you don't need a social security card, but most individuals have accessed the health services. And when accessing the health services, they have been given a BHIS number, all right? And so if they have that BHIS number, it will also greatly assist us when we document into the Belize Health Information System, okay? So they can bring that BHIS number whenever they come to the testing site or also at the vaccination site as well.
Perfect. Thank you so much for that clarification, Dr. Zuniga. So now we would like to move on to yet another question, but before we do that, please remember that we do encourage you to ask your questions. Let's clear up any doubts or misinformation that you may have. And the easiest way to do that, of course, would be to drop your questions in the Facebook Live comments so that we can see it. Remember that even if we don't get your questions at this very time, we will definitely revisit it on the next segment of Up to the Minute. So the other question is, before vaccines, the mandatory quarantine was 14 days. Will the amount of time decrease on breakthrough infections?
The time remains same. We are following the protocols for the management of COVID-19 disease. So having the vaccine confer protection against infection, but for those breakthrough infection and breakthrough disease, the protocols apply.
Great. So the mandatory quarantine remains at 14 days.
Yeah.
Perfect. Now we would like to move on to another question. And this question is, from total hospitalizations, what percentage would you say actually survived? It says here, from total hospitalizations, what percentage would you say actually survived?
From total hospitalization?
Yes, that is what the question says.
11.9.
Or ICU admissions? Just hospitalization?
It says total hospitalizations.
Yeah, it would range from total hospitalizations, let's speak just excluding ICU care, we would say that probably 90% of those patients will recover and they will go home. A small percentage will move into a more critical state in which they will have to be transported to an ICU unit for which they will be intubated and ventilated. And the chances, and we must say, the chances in an ICU are very low of survival, and that is across the board. It's not only for COVID-19 infection. This is for all ICU care.
Yeah.
Okay?
I would just like to remind the public, that we have a lot of chronic diseases, and Dr. Suniga was mentioning earlier, and we're finding that people are showing up with complications due to COVID, and they have their disease is not under control. They're not taking treatment, so that increases the risk for severity and the risk for death due to COVID-19.
And also, in addition to that, we are seeing that persons are arriving to the health facility at a late stage. So we are encouraging persons who are having difficulty breathing or having symptoms that they cannot manage at home to seek care at the nearest health facility. We have COVID-19 centers in every district in this country, in San Pedro and as well in Independence. So you can seek care when you need it as quick as possible. Do not delay seeking care because it can result in adverse outcome for you.
Thank you so much for that to our panel, because each one of you contributed to that answer. We totally appreciate that. And of course, the main message there was not to delay when you are looking into treatment. It is better to get tested if you have symptoms, and if you are positive and experiencing symptoms, then of course it is better to seek treatment. So now we would like to move into another question. And this says, if a person has been infected with COVID-19, should they still get the vaccine? If yes, why? Or no, why?
It is highly recommended that even if a person got infected with COVID-19, they should move on to complete their vaccination if they haven't got the first dose. And if they have the first dose and they got infected, just wait the recommended time from the medical officers and then get their second vaccine.
Perfect. So basically, they should get vaccinated.
Yeah.
It is just a matter of whether or not they need to wait a designated amount of time.
Yeah.
So the next question that we have here is there a specific protocol to be put in place for persons living with HIV whose bodies are already fighting with a virus that suppresses their immune system, that contract the COVID-19 virus, to assure that their essential body functions are not being further broken down by this virus? I'll repeat that because it's a lengthy question. So it says here, is there a specific protocol to be put in place for persons living with HIV that contract the COVID-19 virus, to assure that their essential bodily functions are not being further broken down by the virus?
It is included in the protocols when it comes to vaccination, that these persons that are infected with HIV or have any other immune suppressed condition, we need to explain to them that they will get the vaccine, there will be less protection, they need to know that, so they need to accept that they are receiving the vaccine, but they won't confer the full protection because of their underlying conditions. And it's important for them to keep up with their treatment, and keep up with their well-being, living with the disease or the infection.
And just to add to that, services at all public health facilities for HIV patients are free. So they can receive care and they can receive treatment at no cost.
Yeah.
Now, if we have an HIV patient who is on treatment, we also do follow-up diagnostic testing to make sure that the treatment is adequate and that the patient is controlled, let's put it that way. So we do CD4 counts and we do viral load testing. If these patients have been compliant with their treatment and their CD4 viral load count are appropriate, they will be able to get the vaccine without no issues. Okay? But if they are non-compliant, not on treatment, we would recommend that they seek first medical recommendation to see if they can get the vaccine. Okay?
Perfect. Thank you so much for that. So now we would like to move into another question. And of course, remember to keep dropping your questions in the Facebook Live comments so that we can go through as many while we have our panel of experts here with us today. So this question is in relation to something that we have heard a lot lately, and that is ivermectin. It says here, is ivermectin still on the list of approved protocols?
We are still using it, yes.
In Belize, we're still using it for specific cases. It's a case-to-case basis, so it wouldn't be used on all patients. Okay, and of course, we must get also some type of what we call it, or the family will give us the permission to use it as well. Consent, right?
Okay, so would ivermectin be used mainly in extreme cases since you would need the family's consent?
It depends, as I said, it's a case-by-case scenario.
Okay, great. So we also have another question here that says, why is it that most people die when they go on the ventilator?
We don't want people to go on the ventilator. We're telling you, it's not only COVID, it's all ICU admissions. The chance of survival is low for any type of condition that has or requires ICU care. Unfortunately, COVID we can have very critical patients that need ventilator care. The chances of survival is less. Okay?
Okay, thank you so much for that again, Dr. Zuniga. We move on now to another question, and this says, if a person contracted COVID and already gotten their first vaccine, how long after can a person wait to get their second vaccine?
At this moment, we're recommending 3 months after getting infected with COVID for them to continue with their vaccination schedule. We are revisiting that time, but for right now, it's 3 months.
Great. Thank you so much for that, Dr. Beer. Now we would like to move into another question. And of course, this other question says, why is it that pregnant women have to get vaccinated, and which vaccines are recommended for pregnant women?
For pregnant women, we are recommending the Pfizer vaccine, and it's 2 doses. And it is recommended in any time period during the pregnancy, so it's safe. Pregnant women were not included in the initial trials for the vaccines, but since the use of the vaccines worldwide, a lot of data has been collected, and it showed that it's safe to be used during pregnancy, and especially Pfizer. So that is why we are recommending Pfizer for pregnant women.
Great.
And also lactating women. So women who are breastfeeding. Okay.
Okay, great. So pregnant women and new mothers are encouraged to get the vaccines. And there is the Pfizer vaccine that is approved for pregnant women.
Yeah.
FDA approved for pregnant women. Great. Now we move on to another question. And it says here, after we know that the Delta variant is in Belize, what are the main symptoms of the Delta variant, and does it differ from other variants?
The symptoms practically for all of these different variants are the same. So, and it's as different patients present different symptoms. So it could range from a flu-like symptom, it could range from just a fever. Patients could present with just joint pains or pain in the muscles, diarrhea, abdominal pain, right, headache. So it's not specific. We don't have specific symptoms to say that this is specific to the Delta variant. All right?
Okay, great. So there is no specific symptom that is unique to the Delta variant. And of course, we have another question here, and it says, if you are 17 years old and you want to take the vaccine, do you need your parents or guardians to go with you?
Yes, 12 to 17 years will require a consent form. Once the consent form is signed, the 17-year-old can get it without the parent.
Okay, great. So once the consent form is signed, a 17-year-old can go to their nearest vaccination facilities and get the vaccine.
Yes.
Perfect. And we have another question here that says, does a person need to start over again if more than 12 weeks lapse between the first and second vaccine?
No. So far, we can go, well, the ideal is to respect the schedule. No? If we tell you in 9 weeks, in 10 weeks, you come back in 10 weeks. If you come over 1 week or 2 weeks or 3 weeks after, it's still safe to take the second dose. You don't need to start with a new schedule.
Okay, so even if you have gone a little over 12 weeks, you can go ahead and you can get your second dose. The last question that we have for today's segment is, if someone comes to clean your house and all are vaccinated, does everyone need to wear a mask?
We highly recommend we continue to wear the mask. The vaccine is part of the response to COVID-19, but we're not there yet where we can freely walk around without mask. So especially if you're having people from outside the family coming into your home, we need to continue protecting ourselves.
Perfect. So a mask is essential at all times. Now we have reached to the end of our question and answer segment. I would simply like to invite our panel to go ahead and give your final remarks for today's first session of Up to the Minute.
I would just like to remind the general public that we know and we have the tools that can protect us from COVID. What is important is prevention. It's not about the number of ICU beds, it's not about the number of ventilators that we have, it's about the preventive measures. And we know that we have done well with the second wave, and we can do it as well in this third wave as a community. So we must ensure that we use our masks at all times, the hand hygiene as well, practice the physical distancing, and also when you're in an area, try to ensure that you're in a well-ventilated area, and that will assist in helping us to break the transmission of COVID. And we have one more layer that can help us now, which is the vaccine. So I urge everyone to come out, get your vaccines for COVID-19 and practice the safe public health measures. Thank you.
And the same as what Ms. Bell has been saying, this is a preventable disease. It's not a disease caused by any other means. The third wave has been caused by neglect from us, from the people. We have let down our guards. If we were practicing the simple precautions in regards to the infection control measures that we have put in place, you know, the simple washing of the hands, the simple disinfecting your hands with alcohol or washing with soap and water, the covering of your cough, covering of your mucosas to prevent you from getting it if you're healthy. These are basic precautions, all right? So it's up to us, it's up to the people, it's up to the community. If we want some sense of normalcy, it's the people that need to make that change, okay? And we need to change our behavior in regards to this pandemic. If we do not get to 71%, as Doc was saying, we will not have the liberty and the freedom that we once enjoyed. It will probably come until the end of next year, 2022. So I urge everyone to continue practicing the basic hygiene measures. That is what will get us through this pandemic.
Just to complement what my colleagues have mentioned earlier, we highly encourage every eligible Belizean to receive their vaccine. And if you're feeling ill, or if you come in contact with a person that is positive, get tested. The Ministry of Health and Wellness is offering tests free of cost at the clinics, and now we're expanding to community testing, so get tested. And please, please, please follow the recommendations from the medical personnel. If you're asked to isolate, please stay at home. If you're asked to be quarantined, please stay at home and continue practicing the preventive measures.
Thank you so much for that to our panel, and that is of course Nurse Bell, Dr. Zuniga, and Dr. Beer. Thank you for sharing your time with us today and helping to clarify some doubts and even some misinformation that is currently out there on COVID-19. So we have arrived at the end of our first segment of Up to the Minute. I would just like to mention that the Ministry of Health and Wellness is still doing vaccinations across the country. So in order to keep up to date with the available vaccination dates in your area, check the Ministry of Health and Wellness's Facebook and other social media pages for more information on future vaccine sites. The Ministry of Health and Wellness also advises the general public to keep wearing your masks properly, wash your hands, sanitize your hands, and maintain proper social distance protocols. This is the moment to stop the virus so that maybe we will be able to have a better holiday. So, with that said, what we will be doing now is we will be closing off the segment. So this is the first segment of Up to the Minute COVID-19 live report. Thank you so much for tuning in.